Welcome to Bite-Sized Learning, where we break down complicated topics and make them easy to understand and remember. Today, we're going to dive deep into everything you need to know about diabetes. Diabetes is a chronic disease that affects millions of people worldwide. It occurs when the body is unable to produce or properly use insulin, a hormone that regulates blood sugar levels. There are several types of diabetes, including type 1, type 2, type 1.5, and gestational diabetes. Type 1 diabetes is an autoimmune disorder where the body's immune system attacks and destroys the cells that produce insulin. This type of diabetes usually develops in childhood or adolescence, and it requires lifelong insulin replacement therapy. Type 2 diabetes, on the other hand, is caused by a combination of genetics and lifestyle factors. It's the most common type of diabetes, and it develops gradually over time. In type 2 diabetes, the body becomes resistant to insulin, and the pancreas is unable to produce enough insulin to keep up with the body's needs. Type 1.5 diabetes, also known as latent autoimmune diabetes of adulthood, LADA, is a form of diabetes that shares characteristics of both type 1 and type 2 diabetes. It typically develops in adulthood and is caused by an autoimmune process that destroys insulin-producing cells. Gestational diabetes is a type of diabetes that occurs during pregnancy. It affects about 3 to 10% of pregnant women, and it's caused by hormonal changes that make it harder for the body to use insulin. Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough to be classified as diabetes. It's estimated that 1 in 3 adults in the United States has prediabetes, and most of them don't even know it. Prediabetes increases the risk of developing type 2 diabetes, heart disease, and stroke. Symptoms of diabetes include frequent urination, excessive thirst, and fatigue. Other symptoms may include blurred vision, slow healing of cuts and bruises, and tingling or numbness in the hands or feet. If you experience any of these symptoms, it's important to see a doctor for a diabetes screening. The main causes of diabetes are genetics, obesity, and a lack of physical activity. Risk factors include a family history of diabetes, being overweight, and having high blood pressure. Complications of diabetes include heart disease, kidney disease, and nerve damage. Diabetes is the leading cause of blindness and amputations in adults, and it's a major risk factor for stroke and heart attack. Treatment for diabetes includes a combination of medication, diet, and exercise. A healthy diet for diabetes includes foods low in sugar and saturated fats, and regular physical activity can help lower blood sugar levels. Medications such as insulin, sulfonylureas, DPP-4 inhibitors, GLP-1 receptor agonists, and SGLT2 inhibitors can help regulate blood sugar levels. For pregnant women with diabetes, it's important to manage blood sugar levels to reduce the risk of complications for both mother and baby. A healthy pregnancy diet, physical activity, and medications can help keep blood sugar levels in check. In children, diabetes is usually type 1, and it's important to catch it early to prevent complications. Children with type 1 diabetes need to take insulin injections and monitor their blood sugar levels regularly. So, there you have it, a detailed look at diabetes and all its forms. From the autoimmune disorder of type 1, to the lifestyle-related type 2, and the less common type 1.5 and gestational diabetes. We hope you now have a better understanding of this chronic disease and the importance of early diagnosis and proper management. Remember that diabetes is a serious disease, but with the right treatment, lifestyle changes, and support, people with diabetes can live long and healthy lives. Make sure to like, share, and subscribe for more bite-sized learning episodes.